Good morning, I am Abby Gonzales, a student nurse, and today we will be discussing the drugs that affect the neuromuscular system, specifically diazepam and triazolam. So let's say we have a patient named Mary Burns, a recently divorced 35-year-old who is seen in a clinic today complaining of anxiety and inability to sleep at night. So the primary care provider writes Ms. Burns a prescription for diazepam value 5 milligrams 3 times daily and triazolam 0.25 milligrams at night when needed. So as her primary nurse, we are responsible for developing and discussing this teaching plan to our patient and also consider the additional information from the patient that might be helpful in developing this teaching plan. So for our case facts, we have a patient named Mary Burns, a recently divorced 35-year-old who is complaining of anxiety and inability to sleep at night. She is prescribed with diazepam 5 milligrams 3 times daily and triazolam 0.25 milligrams at night when needed. So first, we must know what is diazepam and triazolam. Diazepam is used to treat anxiety, alcohol withdrawal, and seizures. It also relieves muscle spasms and provides sedation before medical procedures. This medication works by calming the brain, and it belongs to a class of drug known as benzodiazepines. Diazepam is ingested orally in pill form and usually taken 1 to 4 times per day when prescribed by a doctor. We must take into consideration that diazepam is an addictive benzodiazepine. It is meant for people to take on a regular basis. But when someone starts to take it more than the prescribed or without a prescription, they increase the risk of becoming addicted. Side effects that they may experience when taking this drug are ataxia or involuntary body movement, tremors, dry mouth, nausea, or cough. Let's proceed to triazolam. Triazolam is a benzodiazepine similar to Valium. This affects the chemicals in the brain that may be unbalanced, which causes sleep problems. Thus, triazolam is used to treat insomnia. The usual dose for an adult patient having insomnia is 0.25 milligrams orally once a day at bedtime, and the maximum dose is 0.5 milligrams per day. The triazolam can also be addictive, so take only the dose prescribed by the doctor. The side effects that the patient may experience using these drugs are loss of coordination, depression, memory problems, nervousness, and blurred vision. Additional information that might be helpful from the patient is recently divorced. Since our patient is recently divorced, this can be the reason of her anxiety, which can also be connected to her insomnia. So, giving her the diazepam, it will help her feel calm, and since she is calm, this might help her feel sleepy. So, she will not need to take triazolam in order. Another is her age, since this is where we will base that dosage that she will need. And lastly, we can also further assess the patient, or we can interview her if there are other reasons that might contribute to her anxiety or insomnia. And after getting this information, we can now proceed to our teaching plan. So first, we must explain to our patient the interactions between these two drugs so that she knows what to expect or experience after taking. You can tell Ms. Burns that using diazepam together with triazolam may increase side effects such as dizziness, drowsiness, and difficulty concentrating. Since the diazepam side effect is only drowsiness and not really to help the patient sleep, the patient can take triazolam but only when really needed. So tell the patient that triazolam should not exceed 0.5 milligrams per day and take it only when getting ready for several hours. Tell your patient to take only what is prescribed for both medicines because it is based on her medical condition, age, and response. Also, tell her to not increase the dose or use longer than the prescribed because it will not help her improve her condition. It will just increase her risk of side effect. And also, tell her to not stop using her medication suddenly because she might have unpleasant withdrawals. Also, it is important to explain to our patient the interactions of these drugs to food. You can tell Ms. Burns to avoid drinking alcohol while being treated with these medications because these medications can increase the risk of alcohol. She may feel more drowsy, dizzy, or tired. Also, tell her to avoid activities that require mental alertness such as driving unless or until she knows how this medication affects her to avoid accidents. Also, we must tell the patient to avoid eating grapefruit or drinking grapefruit juice until her doctor told her so because grapefruit can increase the chance of side effects with these medications. For missed dose, you can tell your patient, Mary Burns, to take the missed dose as soon as she remembers and to skip the dose if it's almost time for her next scheduled dose. Also remind her to not take extra medication to make up for her missed dose because it might increase risk. Encourage the patient to ask her doctor if she have any questions or concerns regarding her medications, such as how to safely stop the medication, or if she feels that the medicine is not working, or if she thinks that she needs more than the usual. This is Abby Gonzales. Till my next video. Bye!